I'm Kiana Davis, Senior Manager of Educational Programming at the JED Foundation, a nonprofit that protects emotional health and prevents suicide for teens and young adults. Before we get started, it's important to mention that this training does not replace policies, procedures, guidelines required by your school or district. So, in the event of a crisis, it's crucial that you follow all procedures required by your school or district. Okay, let's get into it. Today, we're going to talk about how to recognize signs of distress in students and how to make a warm handoff to additional help. All people experience problems and challenges, and they're an inevitable part of growing up. Dealing with problems and challenges provides young people opportunities to grow and mature and learn about themselves and the world. Many times, students can work out their troubles with help from friends or family or even by themselves. And not every problem requires help, but some do, and that's okay. Signs of emotional distress can be anything that is a distinct or persistent change from a person's typical mood, feelings, performance, social interactions, or other behaviors. This can include changes in school performance. As I read through this list, think about if you've noticed any of these changes in the students you've worked with. Less communication in class, not raising their hand as much, not completing assignments or other tasks, less enthusiasm when working with groups or activities, confused thinking or forgetfulness, trouble concentrating, decrease in attendance, sleeping in class, irritability in response to staff or peer interactions. And you may also notice behavior and mood changes such as irritability or being quick to anger, moodiness, fatigue, being withdrawn, which may include avoiding friends and social activities, impulsivity and recklessness, misusing substances like drugs or alcohol, restlessness, self-injury, poor hygiene, or not eating as much. Some changes may appear positive at first glance, but it could also be worrisome, such as persistent euphoria or excessive excitability, or increased perfectionism or overachieving. If any of these warning signs are present, we encourage you to start a conversation. Connection often starts with a question. So it may be as simple as, "How are you doing today?" Or "What's on your mind?" One of my favorites is, "What's going on in your world lately?" Be sure to actively listen to their response. Active listening means that you are fully concentrating on what a student is saying and not thinking about what you'll say next. As a teacher, you probably already have conversations with students where you use some or all of the key active listening strategies, but let's review a couple of them together. First, paraphrase. Say back to the student what they just said, but in your own words, and make sure that you understand what they're saying, and it also lets them know that you're paying attention. Ask questions. Ask questions to encourage the student to share more about their thoughts and their feelings. Open-ended questions, the questions that start with a how or what or why, keep the conversation flowing better than closed-ended questions that can be answered with a simple yes or no. Show empathy. Validate their feelings by saying something like, "That must have been really difficult for you." Avoid judgment. You're listening to understand, not to offer opinions. Evaluate the conversation. Think about what you heard, and from there, connect to support. Each school community has their own practice for referring students to support when needed. So check in with your school leadership or consult your school's policies to confirm how this works at your school. If you are referring a student to additional support, let them know the next steps. At JED, we recommend a warm handoff. A warm handoff is a trauma-informed way to connect students with support. It shows that you have established trust and that you are there for the student even whenever they're in distress. Imagine you just had a conversation with a student who needs support. What language would you use to initiate a warm handoff? You could begin by thanking the student for trusting you and letting them know why you think the referral could be helpful. For example, I'm so glad that you told me. I'm here for you, and I want to make sure that you're safe. I'm going to connect you to Miss Jackson, who can offer strategies to help you get through this. I know that approaching her out of the blue might seem uncomfortable, so I'm going to introduce you and tell her a little bit about what we talked about today. Now, imagine you've connected the student successfully to Miss Jackson. Your job is done, right? We'd like for you to consider 2 more important steps. First, check in with yourself. Ask yourself, how am I doing? What feelings did this bring up for me? Do I need anything after this conversation? If needed, reach out to your own network or even a mental health professional to support you. Next, follow up. Be sure to circle back with the student to see how they're doing. Continue to offer yourself as a resource where appropriate, because this will broaden their community of care during this time. It's also a good idea to make sure your referral went through and that the student saw the right person and received support. And if there are any issues, you can try to help solve them. Remember, you don't have to be a mental health professional to help, and you can have such a positive impact on a student's mental health journey. Thank you so much.